Hypopigmentation, or the absence or decrease in the amount of melanin or melanocytes, cannot be broken down into a single lecture because there's a lot of things that do that. Chemicals, psoriasis, sarcoid, etc. But what I want to do in this lecture is choose those diseases which are very discrete and identifiable, therefore the ones that are often tested the most. Each of the diseases is in itself, they're not really going to confuse them for one for the other, but we'll talk about some of the details that you need to know as you begin to consider these diseases for the test. Let's start off first with tinea versicolor. This is caused by an infection by a fungus. It used to be Malassezia furfur, now it's globosa. Just know that it's a fungus. It's got a bunch of different names, but if you remember, tinea versicolor, fungus, you're doing okay. The patient is going to present with scaly macules of varying color, thus the name, versicolor. So this is frustrating because this is the hypopigmentation lecture, but this might be hyperpigmented or hypopigmented. Regardless, the way you're going to spot this is by identifying the areas that don't tan. Right? So you're going to see this in adolescents in the summer months because they go get tanned, the rest of the body tans, the affected areas don't, and it becomes more obvious what's happened. To make the diagnosis, you want to take a sample of those scales and do a KOH prep. This is where you're going to see the fungus. What you're looking for is spaghetti and meatballs. You don't need to do a biopsy, just the scraping and the KOH prep will do it. You're going after the scaling region. And to treat it, you just have to kill off this bug, so you can use selenium shampoo or ketoconazole. Topical treatment shampoos gets better. The disease that is compared to tinea is vitiligo. And vitiligo is an autoimmune destruction of melanocytes. And it doesn't happen everywhere at once. There's these patches, but they're sharply demarcated. It's very obvious where these patches end. And these patches are completely white because there are no melanocytes. If there's no melanocytes, they can't make any melanin, and they don't have any pigment at all. So it's complete depigmentation. To make the diagnosis, you do a Woods lamp test, which is going to enhance that area of depigmentation, so it becomes really obvious that it's depigmented. And if you did a biopsy, what you'd see is the absence of melanocytes. The treatment is going to be to reduce the inflammation, right? It's an autoimmune disease, so you want to turn off inflammation. So what you could do for local disease is give high potency topical steroids. For extensive disease, and this might seem counterintuitive, you use UV light. And if you have autoimmune destruction of melanocytes and you gave them UV light, all they would do is burn. But indeed, you can actually improve the condition by giving them UV light. Now, this is more cosmetic than anything else. So you can use makeup to conceal the vitiligo. And if the person doesn't tan, then the comparison of the depigmented areas from the simply not tanned areas is reduced. And so you can recommend to your patients that they don't get tan, or they can attempt to undo the autoimmune destruction. Complete depigmentation also comes into play when you talk about albinism. Albinism is an autosomal recessive disorder where the number of melanocytes is totally fine, but the problem is in tyrosinase activity. And on the way to making melanin, you need tyrosinase to do its thing. And if you have a tyrosinase deficiency, melanin cannot be made. And since this affects every cell, everywhere, the patient is going to be completely depigmented. They are going to be white. Their hair is fair, their eyes are fair, and their skin all affected to complete and total white. The diagnosis is clinical. You don't have to do anything to diagnose albinism. They're born all white, and they stay that way. There's nothing you can do to undo this disease, so the treatment revolves around prevention, and that is keeping them out of the sun. Long sleeve shirts, wide brim hats, suntan lotion. Right? Keep them out of the sun because they have no protection from UV at all, having no melanin. But where you're going to come into play in the test is going after the diseases that look like albinism. If they have a problem with melanocyte migration, or you see the word white forelock, recognize that that's probably going to be piebulbinism. If instead you see a kid who's all white, who has a funny smell, that's PKU. That funny smell causes mental retardation. He's having proteins build up that he shouldn't have. If instead what you do is put him on a special diet, you can ignore that funny smell and prevent the mental retardation. And once the kids develop, they can then go off a special diet because their brain isn't developing anymore. So recognize that there are some other diseases that we're not really going into great detail that can be used to play off what you know about albinism to see if you can figure out what's going on. Instead of just albinism, there are some other genetic diseases you might come across. And the last one is a board favorite because it is a marker of systemic illness when looking at the skin. And that's the ash leaf spot. The pathology here is that it's tuberous sclerosis. And the patient's going to present with a congenital defect of hypopigmentation. They'll have patches that resemble the ash leaf. If you see this lesion, also look for the other skin manifestations of tuberous sclerosis. You should look for the shagreen patches, and adenoma sebaceum. Hyperplastic blood vessels, elevated patches of fleshy plaques. If you see an ash leaf spot, diagnosis of tuberous sclerosis. But what you want to do is make sure that it really is an ash leaf spot. So you put it under Wood's lamp, which confirms your suspicion it's hypopigmented. And then you need to identify the tubers, so do the CT scan of the brain, identify the tubers. You have tuberous sclerosis. The problem here is that once you have tuberous sclerosis, they're going to have mental retardation and seizures and likely die young. But you can identify that patients are going to have this before they develop the seizures and the mental retardation. So you can make the diagnosis on day one of birth by identifying the ash leaf spot. To summarize, tinea caused by a fungus, treat the fungus, treat the hyperpigmentation. Vitiligo, autoimmune destruction. You can try to use steroids or bump it up with UV light. The diagnosis is made by Wood's lamp. Albinism, white from birth, genetic disorder, focus on prevention, and know about some other distractors that might look like albinism but aren't. And the ash leaf spot is the cutaneous manifestation of tuberous sclerosis. Don't forget to diagnose the tuberous sclerosis after you identify the ash leaf spot. That's hypopigmentation.